All right, good morning, everybody.
Morning.
Before we get started, I'd like to recognize the elected officials and staff who have joined us today. Commissioner Dennis Deere. This facility is not only in his district, but he is chair of the Health Committee of the Board of Commissioners for Cook County. We have Dr. Israel Rocha, who's CEO. Yeah, right. Well, I'm not sure that's a promotion, but I shouldn't say that in front of medical staff. All right. Israel Rocha, who's Cook County Health CEO. Dr. Rachel Rubin, who's co-lead and senior medical officer at Cook County Department of Public Health. Deidre Reese, who's our Department of Public Health staff as well. And Otis Story, who's Deputy Chief of Staff for the county. Thank all of you for being here as we celebrate the launch of Building Healthy Communities, a $12 million initiative aimed at building the power and capacity of grassroots organizations and community-based organizations to advance solutions towards racial and health equity across Cook County. Thanks to a combination of funds provided to the county by the American Rescue Plan Act, ARPA, the Centers for Disease Control and Prevention, which of course is the federal government, and the Illinois Department of Public Health, organizations supporting programs related to COVID-19 education, prevention, treatment, as well as mental health, food insecurity, and youth development will now be able to apply for funding to support their efforts in neighborhoods throughout Chicagoland. We're doing this because equity is at the core of everything that we do. We're committed to using an equity lens in policy and practice to help our most vulnerable residents, first and foremost, and in the manner in which we deploy our federal, state, and local resources. Building healthy communities will lessen the impact of COVID-19, stimulate the economy, and build healthier, more resilient communities throughout our region. I encourage community-based organizations to apply for funding so we can collectively advance solutions toward racial and health equity in the county we all call home. Starting today, organizations can go to cookcountyhealth.org to learn more about eligibility details and how to apply for funding. My health partner standing here with me today will provide more details in just a moment. The initiative specifically supports evidence-based programs and systems change strategies that make Cook County a healthier place to live, work, learn, and play. Working with grassroots organizations is critical in reaching our most vulnerable populations. This strategy also helps build trust within the same communities for sustainable, transformative change. That's exactly what we're doing here today. With that, I want to turn the podium over to Commissioner Deere, talk a little bit about what those dollars will mean to our communities. And Commissioner, I ask you to introduce Mr. Rocha, who comes after you.
All right.
Thank you.
You're welcome. Good morning.
Good morning.
It is a delight and a pleasure to be here with each of you all today. I always start by saying God is good and all the time. Amen. We are thankful that we have resources here to help our communities. As President Preckwinkle has just indicated, these are resources that are coming to something that I'm passionate about, and that is mental health and food insecurities. Why? I am a clinician over 20 years for mental health services, and I know that underserved communities, in particular black and brown communities, have not had access to adequate not only health care, but mental health services. These funding opportunities provide just that. There will be RFPs from $50,000 all the way up to $150,000 for the city of Chicago or within the city. In suburban Cook County, there will be grants from $50,000 to $300,000. Guess what? For all of the small businesses who are listening to my sound of my voice today, this is an opportunity for you. We know that you're doing the work on the ground. We know that you are the ones doing the for us, by us. Please apply for these dollars. Come and collaborate, and let's get the work done. As President Preckwinkle said, this is about equity, stopping the violence, stopping social determinants of health. As I won't say Dr. Rocha, but as CEO Rocha has said, Cook County Health has started the Change Institute, and that is geared towards helping these social factors that contribute to health care and inaccess to health care. So we ask you, apply for these funds, spread the word. I am here supporting you 110%. President Preckwinkle is, and so is the whole Cook County Board of Commissioners and Cook County Health. God bless each and every one of you all.
Thank you. Good morning, everybody. Good morning. Good morning. I'm Israel Rocha, CEO for Cook County Health. It's a pleasure to be here with you. And I want to start by thanking President Preckwinkle, Commissioner Deere, and all of the healthcare leaders joined here today for the support that they have given to launch this new grant program. I'm grateful to be here today to discuss the Building Healthy Communities grant program. We are thrilled that these resources available across Cook County will be available to address our community's most pressing needs. Of the $12 million in total funding for this grant program, Cook County Health will be responsible for awarding $1 million to organizations serving the city of Chicago, and our Department of Public Health will be awarding $11 million to organizations serving suburban Cook County. We will be looking to fund programs that address mental health, food inequity, and positive youth development. These are the areas that really came to the forefront during the COVID-19 pandemic. When we saw the challenges exacerbated the infrastructure that we all come to know, we knew that we had to take action to bolster our infrastructure. We know that community-based organizations have a unique perspective in serving our communities. They have built trust in the neighborhoods that they serve, and they are best positioned to make change happen in the communities that reside, in the communities where our patients reside. By making these grant dollars available to community-based organizations, we believe that we can affect the most change in the areas that are most needed, and help our community continue to recover from the COVID-19 pandemic. Together, we know that we can accomplish this task. It is our expectation that these grants will result in the development of a meaningful program that will have everlasting change in our community to hopefully move forward the infrastructure needed in these communities to right these inequities that have been prevalent for so long. This is what commitment to health equity looks like, empowering change where it's needed most. This is how we move the needle in improving the health status of all our residents in Cook County, and we are so happy to be here with you today. To have a few words in Spanish, le quiero dar las gracias al presidente Preckwinkle, el comisionado Deere y todos los líderes de salud que están aquí con nosotros. Su liderazgo y su apoyo por este nuevo programa en serviciones es excelente. Estoy agradecido de estar aquí hoy para hablar sobre los programas de subvenciones Building Healthy Communities o Construyendo Comunidades Saludables. Estamos encantados de que estos recursos estén disponibles a través del condado de Cook para abordar las necesidades de salud más urgentes en nuestras comunidades. De los 12 millones en fondos totales en este programa de subvenciones, Cook County Health será responsable de otorgar $1 millón a las organizaciones que prestan servicios a la ciudad de Chicago, y nuestro Departamento de Salud Pública otorgará 11 millones a las organizaciones a los servicios del condado de Cook. Buscamos financiar programas que impactan la salud mental, acceso a los alimentos y desarrollo positivo a la juventud. Estas tres áreas tienen un gran impacto en la capacidad de nuestros pacientes para vivir una vida saludable y ayudar a esas maneras cuando en los fondos y las áreas que impulsaron durante la pandemia de COVID-19. Por lo tanto, la necesidad es clara de fortalecer nuestra infraestructura existente en esas tres áreas. Sabemos que las organizaciones basadas en la comunidad tienen un impacto positivo y la capacidad única para atravesar los vecindarios que sirven. Al poner esos dólares de subvenciones disponibles a estas organizaciones comunitarias, creemos que podemos afectar el mayor cambio en las áreas que mejor necesitan. Esperamos que estas subvenciones resulten en el desarrollo de un programa significativo para nuestras comunidades. Así es ser el compromiso con la equidad en salud. Así es como movemos la aguja para mejorar el estado de salud de todos los residentes del condado de Cook. Muchas gracias. Thank you so much, and now I am very pleased to bring forward Dr. Rachel Rubin, our Senior Medical Director and Cook County Lead for the Cook County Department of Public Health. Thank you.
Thank you very much, Mr. Rocha, and good morning, everybody, again.
Good morning.
First, I'd like to thank President Preckwinkle for her leadership and commitment to building healthy communities and advancing racial and health equity, and Mr. Rocha and Cook County Health for their continued partnership. And I also want to recognize my tremendous team from the Health Department, led by Deidre Reese and Gina Masuda Barnett in the back there. They've done tremendous work in putting together this proposal and will be leading this work going forward from the Health Department. There is no doubt that the pandemic has amplified the need for the public health and healthcare sectors to address the profound inequities resulting from longstanding historical and structural racism. COVID-19 has unequally affected African American, Hispanic, Latinx, and indigenous populations, putting them more at risk of getting sick and dying from COVID-19. The pandemic further has shed light on the limited availability and access to programs, services, and resources, and the existing inequities and broken systems that had been devastating, has had devastating impacts on populations of color. To help address these disparities, the Cook County Department of Public Health will be awarding nearly $1 million in grants to community-based organizations, community health centers, local municipalities, and K-12 education agencies serving suburban Cook County. And this excludes Evanston, Oak Park, Skokie, and Stickney Township for clarification, all of whom have their own state-certified local health departments and are not in our jurisdiction. In addition to the activities highlighted by Mr. Rocha, eligible activities for building healthy communities in suburban Cook County include outreach and education for COVID-19 prevention, control, and treatment, implementation of chronic disease self-management programs for older adults, promotion of workers' rights and workers' health and safety, deployment of community health workers, advancement of health equity in all policies as an approach for all organizations, changes to organizational policies and practices to improve health literacy, organizational sustainability for advancing racial equity and well-being. Each award recipient may receive a funding amount between $50,000 and $300,000, as the Commissioner mentioned. In addition to funding, other benefits for award recipients include training, technical assistance, and networking through our support. Together, award recipients will increase the use of culturally and linguistically tailored programs and services, distribute resources more equitably, and strengthen the places where people live, work, learn, and play in suburban Cook County. Building healthy communities builds upon previous initiatives and supports advancement of the Cook County Department of Public Health's We Plan 2025 vision, which is a vision for community health improvement in our region that was developed in collaboration with numerous partner organizations and input from community residents, which states, across suburban Cook County, there will be thriving communities where everyone is valued, feels connected and safe, and has equitable access to resources and opportunities for physical, mental, and social well-being. By bringing together several funding streams, our department is maximizing resources to continue responding to the pandemic while also addressing inequities in a sustainable way. And now I turn it back to the President, I guess, for questions.
Thank you.
There, we'll take questions from reporters. We'll start with those in the room. Hannah from WBZ, do you have anything?
Hi, thank you.
Good morning.
Good morning. This is a question
Push,
for.
push the mic down a little bit. will
Oh,
you?
my bad.
You don't have to stand up, just push the mic down. There you
It's a
go.
question for the President and Israel Rocha, but are you seeing any trends related to COVID-19 in Cook County that would prompt us to bring back the mask mandate or shut things down again?
Good Lord, okay. Israel,
Pass it on to.
please.
Hi, so like all communities across the country right now, we're seeing some spikes in our positivity. However, we will be closely monitoring. It's not to historic numbers, so we've seen that spread. We are just starting to see an increase in cases over the last week or two. And so I know that in combination with the Public Health Department and working in combination with all our different sources that we monitor, including the City Department, we will be taking action when we see those numbers continue. And we hopefully that they do not and that it will subside. That's always our hope, our goal. But we are seeing a few of those numbers, but nothing that has prompted any new actions from our department. I don't know if Dr. Rubin, you need to add anything.
I mean, to reinforce that point, we are seeing an uptick in cases and an uptick a little bit in emergency room visits, but our hospitalizations have remained flat and at a quite low level. And even though we anticipate in a week or two those hospitalization rates may bump up a little bit, we're hoping that it won't reach the point where we need to put in place more specific mandates. However, I would say that this is a warning that we all should be wearing our masks. Even though it's not a mandate, I would certainly recommend that we wear masks, especially if you're going to be around people that might be at higher risk for complications. And of course, if you haven't been vaccinated and you're eligible for boosters and you haven't gotten boosted, please do so. The vaccines are widely available throughout the county.
Nope, that's it. Thank you.
All right, I know we have WTTW on the line. Do you have anything?
Hi, thank you. Kristen from WTTW. Thank you for taking my question. I was wondering, in terms of the eligibility requirements, if you could talk a little bit more about that and the tentative timeline for kind of selecting organizations and then starting to roll out funding to them.
All right, so the question is eligibility for the grants and the timeline.
The RFPs are being released momentarily. And there will be a series of meetings set up that will give appropriate information to potential grantees. And there's going to be a long process, not long, there's going to be a concerted process for evaluating what we imagine will be quite a large number of applications. And we hope to put things in place in terms of the monies beginning to be dispersed in the fall. Is there anything else you would like to add?
Yeah, why don't you come to the microphone and take your mask off? Introduce yourself.
Hi, my name is Deidre Reese, Regional Health Officer, Cook County Department of Public Health. We really would like to encourage those people that are interested in this RFP to participate in our information sessions, which will be next week. I think that will be critical for each of them to learn exactly what is in the application, the eligibility, and we'll also walk through the process for answering questions. So those information sessions will begin next week, April 19th, April 20th, and April 21st. And so we encourage you to register, participate in those sessions, and we'll be able to go through all of your questions and eligibility, and we'll walk through the RFP. So it's really important that people participate in that.
All right, and how can they find out information?
And you can find out information about that on the Cook County Health webpage, or you can go to the Cook County Department of Public Health webpage. There's a banner there, and there's a link that'll take you right to Building Healthy Communities. The web address is cookcountypublichealth.org, or you can also go to the Cook County Health RFP webpage, so cookcountyhealth.org as well. You can go to either one, and it will give you information on where to find Building Healthy Communities grant program. There's Suburban Cook County and for Chicago.